Hi and welcome. It's Jessica Drummond here from the Integrative Women's Health Institute. And today I have some training for you on how to use elimination diets effectively specifically for clients with vulvodynia, though this overlaps quite a bit with clients with interstitial cystitis and painful bladder syndrome as well. So let's get started. We're going to be talking today about what is an elimination diet, what are the mechanisms by which elimination diets can support pain relief in our patients with vulvodynia, and I'm going to walk you through a case study. So as a disclaimer, this information contained in this presentation is designed for professional education only. This information is not intended to treat or diagnose. This information is provided by the Integrative Women's Health Institute and is not intended to replace the medical advice of your physician or healthcare provider. Please consult your healthcare provider for advice about any of your specific medical conditions. So what is an elimination diet? An elimination diet is essentially an assessment strategy. The goal is for a period of time, enough time to really quiet the immune system, which that's why it takes about 3 weeks, to eliminate specific foods that are likely in that particular individual to provoke a response from the immune system. A response such as increased inflammatory cytokines, IgG, that should say IgM, IgE, or other immunoglobulin responses, local irritation to the intestinal mucosa, which will then predispose someone to having increased intestinal permeability, otherwise known as leaky gut. So it's an irritation of the immune system with various mechanisms due to the immune response against that food, which should, theoretically not provoke an immune response, given that the system were healthy or that the food is actually a natural food. So how do we choose which foods to eliminate? Well, what I tend to do and what is done is to take a look at what are the most common foods that literally everyone tends to be irritated by. And that's one way to do a broad elimination program. And that's most commonly effective in clients who are looking to reduce general inflammation, belly fat, cardiovascular and stroke risks, cancer risks. So this is kind of looking at general health and reducing general chronic inflammation. And there are specific foods that tend to provoke those responses in the vast majority of people. Dairy, gluten, soy, eggs, peanuts, sugar, and sweeteners, things like that. The other way we can do this if we're working with an individual is to first individually test them for IgG responses or a more general immune response. So you can use food sensitivity testing as a foundation for designing the elimination protocol for a particular client. Or what we have done in particular for clients with pelvic pain, and especially for those that are most complex, that tend to have endometriosis, interstitial cystitis, and or vulvodynia. So often they have several of these, is to look at the literature for all possible triggers, anything that's been studied and reported in this patient population. And this is what we use with our clients with the most complex pelvic pain issues. We've designed a particular elimination diet protocol that fits with what we've seen, from kind of scouring the literature on any food sensitivities. And also, I've been working specifically in this area of pelvic pain for nearly 2 decades. So, and nutritionally for about 6 or 8 years now. So some of it is also based on clinical experience. And then we take a look at, okay, what are the personal factors that this particular client is coming to us with? Are they vegan? Do they have a particular blood type, which can give some clues as to some of their underlying genetics? Do they have a need to slowly increase fiber? Maybe they've also got some gastrointestinal issues or recent surgeries. What are their taste preferences? Do they have a history of emotional eating or eating disorders? What is the sociology of eating like in their family? Is, eating synonymous with love and celebration? So we have to navigate all of this. But again, remember that this is not designed to be a long-term strategy necessarily, to be thinking of living life in an elimination protocol. The goal is to do this for 3 to 4 weeks as an assessment tool to figure out which foods are most irritating to that particular individual, and then try to figure out why so that we can make the diet as flexible as possible. And there, in many cases, are particular foods that the client will end up not eating for the long term or eating in much smaller amounts. But we will also design a program around that such that it doesn't feel at all deprived, that, they can live a joyful life and socially eat, without feeling very, very restricted by their eating. Now, a caveat to this is some clients, especially with these pelvic pain disorders, do have other sensitivities to common anti-nutrients, and these are essentially part of the plant's immune system. So oxalates, lectins, these kinds of anti-nutrients do tend to provoke sensitivities in many pelvic pain clients. However, what I find clinically is that often it's a result of that client having hypochlorhydria or low stomach acid. So while, again, in the short term, eliminating these foods from the diet can be very healing, it's not a good long-term strategy because many healthy plant-based foods have oxalates and lectins in them. So what we want to do is just optimize the digestive function. And in many cases, that comes down to looking at the stress response, looking at hormonal health, looking at, what are their stress management activities that they're doing? Are they exercising, over-exercising, under-exercising, the wrong kind of exercise? Do they have adequate stomach acid? And we may need to supplement with things like betaine HCl and digestive enzymes. So we go a lot more into this in our course, which you can find at pelvicpaintraining.com. pelvicpaintraining.com. But, just know that sometimes it's important to not just remove everything that the client is sensitive to for the long term, but to consider how to optimize digestive function so that that client becomes sensitive to fewer things. So keep an eye out for that. So when are we looking at, using elimination diets in clients with pelvic pain issues such as vulvodynia? Well, commonly comorbid with vulvodynia, for example, is IBS and other digestive function issues. So if you have comorbidities, gastrointestinal comorbidities with your client that is struggling with vulvodynia, then we absolutely want to address those because of the neurologic connections in the pelvis, we can often have essentially organ crosstalk, and the pain can be worsened when the IBS symptoms are worsened. The vulvodynia symptoms can become worsened and vice versa. And vulvodynia patients are 2 to 4 times more likely to also be diagnosed with IBS. We also want to do things like reduce systemic inflammation, so interleukin-6, prostaglandin E, as well as B and T cells the activation of these cells looks like a local immune activation in vulvodynia. So if we can quiet the inflammatory immune response more systemically, again, we can quiet that local immune response in the vulvar tissues. And also, there are a lot of clients that have vulvodynia that also have not just comorbid gastrointestinal issues, but comorbid dysbiosis of the vulvovaginal canal. Things like chronic yeast infections, chronic BV. And so programs that are very low sugar, even eliminating fruit, and we can use antimicrobial herbs and specific probiotic strains to address this comorbid candida or yeast infections that can also be very helpful. So there are a number of mechanisms that are at play here when we're utilizing elimination diets to really optimize the functioning of the digestive system, the endocrine system, the immune system in particular, and to thus quiet the symptoms of these pelvic pain diagnoses. So I talked about how particular foods are very common sensitivities in the vast majority of people who are struggling with food sensitivities or chronic inflammation, related to things like cardiovascular disease, prediabetes, diabetes, metabolic syndromes, stroke risk, cancer risk, things like that. Some people are walking around with this and not really recognizing that food sensitivities could be involved, but these are these very common ones. Wheat or gluten, casein, dairy, soy, corn, eggs, peanuts, and these are the most common that we deal with in every person. So if you want to start somewhere, just eliminating these with your clients with pelvic pain is a good place to start. And then and one of the reasons this works so well is when we stop irritating the intestinal mucosal barrier, then there is less of an immune response to, undigested food particles or food particles that come in that clients are sensitive to. So this is the kind of place to begin. And as I said, we've gone a lot deeper with this and really scoured the literature. You can learn more about that at pelvicpaintraining.com. But, anyone can start here. The other thing I wanted to bring up today, it's a little bit new in how I'm thinking about the immune connection with my clients with vulvodynia and also with interstitial cystitis, bladder pain syndromes. I'm seeing more and more mast cell dysfunction, histamine intolerance in my clients with pelvic pain. And I looked at the literature and there is some overlay here. So, for example, there was a study done with specimens of 35 patients who had vulvodynia. These cells were evaluated histochemically with antibodies to CD3, 4, 8, 20, 117C, and human mast cell tryptase, and for the WHO criteria of neoplastic mastocytosis, which has particular criteria listed here. All of these cells showed mast cell activation. And so we're seeing some relationship between hyperactive, mast cell activation, maybe hyperactive histamine response that some of our clients with vulvodynia could be sensitive to. And 74% of these patients with vulvodynia also had concomitant autoimmune diseases such as psoriasis, allergies, or they had preceding infections like we talked about with chronic yeast infections, chronic bacterial vaginosis. And so what we're seeing here is that, could be potentially classified even as a secondary mast cell disorder, which is just essentially showing us that the immune system becomes hyperactivated in up to 3/4 of vulvodynia patients. And, what I'm starting to see when I see any kind of red flags of this mast cell activation or histamine intolerance is these clients often have additional histories of autoimmunity or histories of allergies. They tend to break out in hives very easily. They have very sensitive skin. They're very sensitive to supplements and don't tolerate things well. They're very sensitive to foods, lotions, things like that. Their histamine response, which is really kind of the comparative response on skin allergen testing, is very extreme. And they have homozygous genetic SNPs for DAO and HMNT. And these are the genes that encode the enzymes that break down histamine. So keep an eye out for these things if your gut feeling is that this client may have a histamine issue. And I don't have a lot of time to go into this today, but here are some supplements and bioflavonoids, vitamins that do help with, because they are mast cell stabilizing and they are antihistamine. So, but we have to, again, be very careful because these clients tend to be quite sensitive to many things. So we have to test these things in small amounts and, one at a time. Now, what we can do is nourish the foods that are on the enjoy list, on the to eat list, can be high in these healthy natural mast cell stabilizers and antihistamines. Things like peppers, strawberries, citrus, Brussels sprouts, cabbages, garlic, spinach. But notice, some of these are high in other things that can irritate this population. So we have to be very systematic about how we implement the elimination diet in this population. So what we're going to do is remove everything that might cause irritation. And what we do in our program is, again, we've looked at the literature. We kind of hit those big 6 or 7 foods. We take out nightshades. We take out sort of the quote unquote IC diet, bladder irritants. So things like spicy foods and citrus. And we just take all of that out. Vitamin C, most vitamin C is actually made from fermented corn. So that kind of vitamin C can be very irritating to the bladder or vulvodynia for obvious reasons. So we take a lot of things out, but again, just for 3 weeks, 3 to 4 weeks, to give the immune system a chance to have a break and recover. And then we add the foods back that my clients are missing the most. They're like, oh my gosh, I really can't live without cheese, or, can I please have a little bit of rice? One of the things we take out is grains, so we get back to the foods they're clamoring for most first, and we go very systematically 1 week at a time, where we reintroduce one food at a time, one serving 2 to 3 times a day. And we monitor these symptoms for 3 days. Then, so let's say we're reintroducing dairy. Monday might be, 2 servings of raw, cow's milk cheese. And when we reintroduce dairy, we're very particular to re-challenge cow's milk separate from goat's milk, separate from sheep's milk, because some people can tolerate some of those, but not all. So, the first on Monday, there might be a cup of, fresh organic yogurt, no sugar or low sugar, a cup of, a serving of organic cheese. Raw milk cheese is the best. Again, choose wisely which milk you're using. And, we do this a couple of different ways, a glass of healthy organic milk over those first 3 days. And then stop, take the dairy back out again, and just kind of observe for the final 4 days of the week if there are any delayed reactions. So what are we looking for when we're looking for particular reactions? Well, common symptoms that indicate any kind of immune response to this food would be changes in energy levels, changes in bowel movements, stiffness, pain, or fatigue, certainly the reproduction of the original pain, skin breakouts, rashes, redness, weight gain, difficulty breathing or congestion. Feel like a lot of times, especially with dairy, I'll say, oh, well, I think I got a cold that week. Probably not. You probably were irritated by the dairy. Bloating, gastrointestinal changes. So if a symptom or several symptoms occur, then the reintroduction is stopped, and the patient has to wait at least 7 days or just until that response clears up before introducing another food, and really allowing that inflammation to quiet down. And so we want to be patient with this. It's one food per week, and just slowly and systematically perform the reintroduction so that we know which foods are bothersome and which are not. So let me walk you through a case study. I was working with a 28-year-old female. She had a 12-year history of vulvodynia, She had treatment failure with medication. She refused surgery. Her treatment plateaued with physical therapy and psychotherapy. So she came to me, still having flares of about 7 to 8 out of 10. And she had a long-term family history and personal history, essentially her whole life, of having irritable bowel syndrome. She was vegan and a graduate student. She had a very high stress lifestyle. She reported painful sex, and her pain would flare with stress. And she also had vulvar pain outside of having sex. So we mapped out a timeline of her case, and you can see this in full detail in the case report that we published. The citation is listed here. And so several things happened before she came to see me, and she did continue her physical therapy off and on throughout our work together, and she continued massage therapy throughout that intervention as well. So we started in May of 2015 on a vegetarian elimination diet. She did include eggs, and I can't remember if she was eating eggs before that or not, but just as an option for protein, because we eliminated meat, dairy, soy, all grains, peanuts, corn, which is a grain, sugar, and artificial sweeteners. And I wanted to be mindful that she was getting some protein because she was vegan, or at least vegetarian prior to that. She had been relying quite a bit on soy protein, and we were going to be eliminating that. So we had to think through to make sure she was going to be getting adequate protein. So we did all of this elimination for 3 to 4 weeks. And her first follow-up, a couple of weeks into it, she immediately had a complete resolution of her vulvodynia. Now, she was hungry, so we had to work through that and make sure she was eating adequate calories, make sure we streamlined and made it easier for her to eat well without becoming more stressed by the plan. She continued to follow the elimination diet for an additional 2 weeks. And I also referred her to a functional medicine colleague of mine, and we collaborated on testing and supplement recommendation to be even more personalized. So by her third follow-up, her vulvodynia was completely resolved. And so then we modified things to begin to re-challenge this elimination diet, as I was discussing. And we have to do this very systematically. And the first re-challenge was one at a time, soy and then rice. So what we found was that the soy very immediately provoked the reappearance of the vulvodynia. She also had skin symptoms, fatigue, menstrual cramping. She had also a significant vulvodynia flare-up with the reintroduction of goat dairy, which actually many of my vulvodynia clients do tolerate because goat dairy is a smaller protein and it tends to be easier to digest than cow dairy, but not the case in her case. Anyway, so we took all of those things out. Rice was fine. And then retested the soy and and we tested cow dairy, none of which, worked out very well. The goat dairy she was more sensitive to than the cow dairy, but later she began to realize that being completely free of dairy was her more optimal situation. Then we had done this functional testing, and you can see here that as we completed through the reintroduction slowly and systematically over a period of about 5 months, we really mapped out a very clear plan for her from a nutrition standpoint that she was very happy with. We had lots of foods for her to enjoy. She learned how to order healthfully in restaurants. She was cooking, and she was, eating and with her busy schedule without a lot of stress. So she found that, we kind of landed on the optimal nutrition plan for her. And then we dug deeper because we wanted to maintain this optimal functioning of her digestive system, her immune system, her hormonal system, her endocrine system, and keep her pain at bay. And so we looked at the results of the lab work that she had done with her functional medicine physician and found a vitamin D insufficiency, so supported that with vitamin D supplementation. She still, for a little bit, had painful menstruation, and there's some good data that shows that cramps during the period can be resolved with fish oil, 1 gram once a day. So we did that without, any particular labs. She also had elevated homocysteine and some genetic SNPs related to methylation. So because of this evidence of decreased methylation efficiency and B12 deficiency, we supplemented with sublingual vitamin B12 in the methylcobalamin form, and later with methylfolate as well. Low magnesium, and she had a magnesium deficiency. And so we supplemented nightly with magnesium, which also helps with sleep and pain relief. Elevated lactoferrin and calprotectin and low secretory IgA, all of these on her stool testing were signs of bowel inflammation and low immune function in the bowel mucosa. So supported that with not only eating a lot of vegetables, which she was, both cooked and raw, and also supported with some particular fiber, prebiotic fiber, and probiotic supplements. And then low pancreatic elastase shows inefficient digestive enzyme function. But she really didn't need the digestive enzymes once we added them. We added betaine HCl and digestive enzymes. She was okay with taking just a digestive enzyme supplement that helped a little bit. And we did that, just as needed for support. But she did not have hypochlorhydria or low stomach acid. Her betaine challenge was negative. She ended up just not feeling great with adding the betaine HCl. So we took that out after a month or so trial. And so this really supported her long-term optimal health of each of these systems in combination with that elimination diet. So I followed up with her 5 months later, and she sent me a note that she was able to resume eating some gluten prior to and during a vacation to France. I mean, hey, who wouldn't, right? Without any increase in symptoms. But, when she came back, she was able to tolerate small amounts of high-quality bread products without any increase in symptoms. So she just did that as tolerated. When she would push it a little far, her symptoms would flare up. But the key here is that she really gained empowered control over nourishing herself in a way that supported both her fun and her life and her health. When she did increase her consumption of food irritants, her pain level and IBS symptoms returned and worsened. But because she's very aware of her symptoms, she kind of walked through that elimination diet, leading the way, really tracking her symptoms, really tuning into her body's responses. She really gained a lot of power, control over how to utilize nutrition to optimize her health and reduce her symptoms. So she's now independently maintaining her nutrition program. As of then, it was 5 months post-discharge. I've talked to her since then. She's just doing just fine. And, this was the written pain perspective that she gave to us. And she basically said, hey, my pain has been incredibly decreased overall since I started this program, and my irritable bowel symptoms are much better. I'm not presently using any vaginal creams, and I did not feel any increase in pain. I think soy was a major trigger, and since eliminating it from my diet, my pain level has significantly decreased. Now, when I get a flare, the worse it gets is to maybe a 3 out of 10, whereas before it could be an 8 or 9 out of 10. I've started physical therapy again, and I'm working on reducing the tension in the pelvic floor. I was able to jump back into PT with more ease and bring in new breathing techniques and stretches. Now we don't have to spend much time on the pelvic floor muscles. Everything is going in a good direction. And this is key. Listen up here if your clients are struggling with utilizing the elimination diet as a tool. The elimination diet is definitely a challenge, right? Our clients have to take ownership of this. However, it is completely worth trying it if it means it can help heal your body after so many years of pain. In order to really receive the benefits of the elimination diet, you definitely need to be committed to the plan, which can be hard, especially for a very active, busy woman. But it is really all possible with the help of a knowledgeable and patient nutritionist, advice from a team of other medical professionals who care about you, and support from your friends and family. And we always emphasize that in our programs with our clients. You need a web of support, a clinical web of support and a home team web of support. And finally, the most important part of successfully completing the elimination diet is giving yourself permission to focus on yourself, because you deserve to live a happy, healthy, and pain-free life. And that's straight out of her mouth. So thank you. And, I have seen this work over and over again. It requires commitment from the practitioner and from the client patient. But then the patient leaves with this really strong understanding of how she's living, her stress, her nourishment, her relationships are impacting her particular pelvic pain symptoms, and really helps her to really have control over the dial of optimizing her health. So thank you. And if you would like to learn more about our holistic approach to chronic pelvic, sexual, and vulvar pain management, please visit pelvicpaintraining.com. Thanks so much. Bye-bye.